Well, after years of trying, the Kentucky legislature has given its approval, and the governor has signed a landmark heroin bill that not only clamps down on dealers but improves drug treatment. Matter of fact, the sponsor of the House version of the bill, John Tilley, calls the measure a public health solution to a public health crisis. Coming up on Kentucky Outlook, we're going to talk with two in the know, in the trenches, the drug czars. Coming up next on Outlook. Hello and welcome to this week's edition of Outlook. I'm Barbara Deeb. We're so glad you joined us. You know, the Kentucky legislature has adjourned and they got a lot done. In particular, one thing of import is the heroin bill. And as I said earlier in the introduction, it's been a long time coming. We're going to talk about it and what it means for the people of the Commonwealth as we welcome to the program two people who daily deal with this situation. We welcome to the program Tommy Loving, who is the director of the Bowling Green Warren County Drug Task Force. Thanks for being here.
Yeah, thanks for having us.
And in addition, Van Ingram, who incidentally missed the signing of the bill that he's worked on so hard to be here to share this story with you. He is the executive director of the Office of Drug Control Policy. Thanks for being here, Van.
My pleasure.
Appreciate it. Before we go any further, we've had both of you on this program in years past talking in general about the drugs that are the drug of choice at the moment, and methamphetamine has always seemed to be the issue, at least in these parts. Talk to us about that.
And unfortunately, it still is.
Okay.
What we've seen recently, and you've probably seen this in the news, I guess about 3 weeks ago, we seized 1.6 pounds of crystal meth, which is the imported Mexican meth, has a much higher purity level than the what's made in, as I refer to, the Bemis and Butthead labs that we deal with locally. So that's something new.
1.6
pounds.
Yeah. Okay.
And then on top of that, the state police have taken off in Todd County a couple of weeks ago. I think it was 20 pounds, and then over in Muhlenberg about 23. So
what's the street value of something like that?
I think those were estimated about $1 million.
Okay.
I think ours, we were looking at a street value of around 50,000. And with our case, we were able to further that and recently made inroads in where it was coming from out of California. So we'll talk about that another day, but we're making progress there. But I guess the point, when we started seeing crystal meth, we thought the meth labs would certainly decrease, maybe even go away.
Now, why is that? For someone who is clueless about these kinds of things.
Most of our meth addicts, obtain their meth through a local meth lab or the meth lab process. And so that was the source. With this sort of quantity coming in, you would think that there would no longer be the need for the local meth labs,
okay,
which make small quantities. However, that doesn't seem to be the case. In 2014, in January and February, we had 8 meth labs in Warren County that we discovered. And this year, in January and February, we've had 16 meth lab incidents, because I want to qualify that there may be multiple labs in one location, but we count it all as an incident. So that has us scratching our head a little bit to try and determine what's going on, because they should be going down, not going up. And with that said, we don't see the heroin activity here that they have in other parts of the state. Yes, it's here. We had 3 overdose deaths that'll be related to heroin last year. So we're also working on addressing that problem, hoping it doesn't get worse in Warren County.
In Warren County, no kidding. So now help us understand what the Office of Drug Control Policy does as it relates to these issues.
Well, we do a lot of things, but most recently we helped craft this heroin bill, and work with the legislature and work with the governor's office to move this thing forward. Just to back up to Tommy's point, people ask me all the time, say, Van, what's the worst drug problem in Kentucky? And I have to say, well, tell me what county you're standing in before I can answer that. And for whatever reason in Warren County, they've struggled with meth for so many years. If you're in Campbell County, Kenton County, Boone County, heroin is the #1 threat. If you're in Perry County in eastern Kentucky, pills are still the #1 problem. And in Louisville, you might have all three or four,
Right.
A number of drugs. So it's really interesting and unique, and it's something that it's kind of unique to Kentucky how regionalized our drug issues are.
That is interesting, like the counties. But that speaks to the bigger issue then of how do you legislate, regulate, and control these kinds of things when you've got so many tentacles out there?
Well, going back to Tommy and the meth situation, it's interesting. In 2012, the legislature passed a law greatly curtailing how much pseudoephedrine you could purchase,
which is used in the
over
making,
a 12-month period.
pseudoephedrine, used in the making of meth,
Yes, ma'am.
amphetamine. Okay.
And overall, we're down statewide about 40% in meth labs statewide. But here in Warren County and in some other counties in this region, that's just not happened. So you kind of pick the best strategy you can and you hope it works, and sometimes it does and sometimes it doesn't. And then you have to back up and try something else. But we can't give up.
You can't give up.
There's
You have
human
to be.
lives, there's human capital at stake here. And so we're always looking for the best policy solutions.
Well, as it relates to policy solutions, so why is it then that this time in the legislature that the heroin bill, because like you say, for years you've been working on this. Well, let's pick it apart a little bit, okay? There are several facets to this heroin bill, okay? And one of them, the more controversial, is the needle exchange portion of it. So let's backtrack a little bit. What, in your opinion, as doing what you do with the Drug Task Force, what makes this bill so important?
Well, I think the whole bill. Certainly, I'm the law and order guy, and we want to put drug dealers in prison. But also, I think I've learned over the years that if we have addicts, we need to treat them, because some percentage of those people will get in recovery and not be clientele of ours again, and that's a good thing. So there are a lot of things I like about this bill. For the higher level drug traffickers having to serve, at least have their sentence before they get out of prison, and not going in for a 10-year sentence and come out in 18 months.
Because that's been the case in the
That's
past,
been the
that
case
these people get.
Much too often.
Yeah.
So I think that's a good thing. We'll see where the needle exchange goes. Early on, I wasn't real sure that was a good idea. The more I learn about it, if you look at the track record in other states, it certainly has some public health benefits that maybe we need to look at.
Let's back up and explain for our viewers what we're talking about when we say needle exchange. Maybe you've heard about this with drug addicts in larger cities. It seems to be something that in urban areas is more popular. But basically, what are we talking about here?
Barb, a little over 10 years ago, I left as being a police chief in Maysville, Kentucky, and came to Frankfort. And if you'd have told me at that time I would have been an advocate for needle exchange, I would have thought you were crazy. But then as this heroin problem got worse, we saw hepatitis C rates just skyrocket. We're seeing people
HIV.
dying, not just of overdose, but dying of abscesses from using dirty needles. Some horrible health outcomes. And so over the interim, in between legislative sessions, I went and visited some of these programs. And here's what's interesting about it. They do a lot more than exchange needles. When someone comes in on 2 to 4 on Fridays, when they have this program in Portsmouth, Ohio, they have the opportunity, that healthcare worker has the opportunity to say, I've noticed you got an abscess on your arm, we can help with that. If you're concerned about HIV or hepatitis C, we can get you tested. And oh, by the way, when you get tired of living this way, come back and see us, because we're going to help you get into treatment. And meeting people where they are in kind of a non-judgmental way, and trying to move them through motivational interviewing, through a number of different techniques to where you want them to be. Nobody wants to live like that. Nobody wants to live where every day they get up and the mission for today becomes, how do I get enough heroin to keep from getting into an going into withdrawal today. But you have to, far too often, we have been diagnosing the disease of addiction in the criminal justice system. We need to be diagnosing it more in the professional medical community than in the criminal justice system. By the time they get to the criminal justice system, many years have been wasted, and they're much farther along in this disease process than they were.
And you hit the nail on the head when you said disease, because it has been determined that addiction of any kind is, to a large extent, a disease. And why is heroin so accessible? Is it cheaper than the methamphetamine?
Well, it's
is it more
interesting,
accessible?
yeah. If you look at DEA's threat assessment report,
Drug Enforcement Agency.
the Drug Enforcement Agency, I'm sorry, the amount of heroin seized at the southwest border quadrupled between 2008 and 2012. That's not a coincidence. That is Mexican drug cartels flooding our country with heroin. And in all honesty, it's not hard to figure out. We already have a huge opioid painkiller problem in this country. We've taken some steps to address it here in Kentucky. We've made some headway, but it didn't go away. And here comes a cheaper, more available alternative in heroin. If you're trying to get prescription pills to divert, to use illegally, or to take that aren't prescribed to you, you got to make an appointment with a physician. You might have to pay for that visit. You're going to have to go to a pharmacy to get that filled. If you get a prescription, you're going to have to pay for that. All these things take time and effort. Or I could go to the corner where my local heroin dealer is, and in 10 minutes,
I got my fix.
I got my fix, and it's in my arm. So there's a lot of folks that want to say, oh, well, you addressed prescription drugs and you caused this heroin problem. It's much more complicated than that.
Yeah, and I think
Much bigger.
to what Van's speaking, that time frame, we knew back in 2008 that the Mexican cartels, they're business people. They're criminals, and certainly
they have a system.
violent criminals,
yes.
but they understand business in dollars and cents. And they knew of the pill addiction we have across this country, and they said, we can pump up our heroin production to switch people into heroin where we make the money instead of going through the different routes of obtaining pills and the illegal pain clinics and whatnot. So that's about the time they started to ramp up production, and now they're in full swing.
In full swing, Mexican drug cartels in Kentucky. In addition, there's a new drug on the market. It's called Vivitrol. Could it help heroin addicts? We're going to talk a little bit about that when Outlook continues. We're going to take a short break, so don't go away. We'll be right back. Outlook continues. I'm Barbara Deeb. On the program today, we are talking about it's a new law in the state of Kentucky, the heroin bill. It just passed the 2015 legislative session, and Governor Steve Beshear signed it into law today. We're going to continue our discussion as we welcome back to the program Van Ingram, who is the executive director of the Office of Drug Control Policy, who missed the signing of that bill to be here with us today, and we appreciate that.
My pleasure.
Thank you. In addition, Tommy Loving joins us. He is the director of the Bowling Green Warren County Drug Task Force. Now, before the break, we were talking about the new bill, the heroin bill. So I'm going to ask both of you to just kind of recap that for us, for our audience, if you will.
Well, I think I'll do the sentencing side.
Okay.
Anything above 100 grams now is a Class B felony, 10 to 20 years.
How big is 100 grams? What are we talking about there?
Oh, we're talking about a little under 4 ounces.
Okay.
But a heroin trafficker that has that much heroin for sale is not a small street corner dealer. They're a supplier, a major supplier. That person now is going to have to serve at least half the sentence they get instead of 10 to 15% like they would under the existing
Previous.
guidelines.
Okay.
So we get our major traffickers off the street and in prison. I'd like to think they're rehabilitated, but at least they're out of the neighborhood. So that part's really good. And then we've talked about there's some really other areas that are
really
very
a comprehensive bill. It does a lot of things. It expands access to naloxone, a drug that stops a drug overdose in its tracks. Gets it in the hands of police officers, firefighters, family members of addicts, that type of thing. The bill provides for Good Samaritan provision. So if a couple of people are using together and one of them goes into an overdose situation, oftentimes a friend or neighbor won't call the police because they're afraid they'll be arrested.
They don't want to get in trouble.
Yeah. This bill provides a Good Samaritan clause. It says if you call 911 and stay with the person, you won't be charged for a small amount of drugs or paraphernalia. The bill sets aside about $10 million to do some things around treatment in jails, treatment through our community mental health centers, increases some funds for prosecutors and the Department of Public Advocacy. So it does a lot of things in this bill. And I think when you've got a big public health problem, it takes a big public health solution. A lot of the things in here are harm reduction models, they're public health models, and then there's the traditional law enforcement things that Tommy talked about. But you know, the things that we've had success with, reduction of meth labs, reduction of prescription drug abuse, those were big bills that did a lot of things. And it takes a big approach
to combat this problem.
To make the needle move.
And I think this naloxone is a good component. I know a year or so ago I went to a briefing by the Quincy, Massachusetts Police Department. They kind of pioneered the thing, if I'm not mistaken.
So this is a drug, it's called Naloxone.
Naloxone.
Okay.
And don't ask me to spell it.
Okay.
But what this drug does is immediately reverse a opioid overdose.
So if someone's having an overdose from heroin or other opiates, they can take this and it immediately reverses
basically
it?
Shoot it up the nose and
Wow.
There's an auto injector, you can do it that way. There's a nasal injector, and then of course intramuscular injection, it can be done that way. But what it does is temporarily blocks your opioid receptors. It's why it's important. If you use naloxone, you still call 911 and you still call an ambulance because the person will slip back into overdose quite often. But you know what happens in an overdose situation is you've stopped breathing.
Well,
your respiratory system is shut down.
But back up just a little bit. For those of you, we did a little research, some of my crew and I, about heroin. What exactly is it? Plant-based? Is it synthetic? Is it constructed? So it's an opiate, and it comes from the poppy plant?
Yes.
correct.
Okay. So that having been said, are there variations on a theme, if you will? In other words, so we start with one maybe pure substance, but then it becomes convoluted along the way?
Sure, and that's such the danger when people are switching from, when you've been abusing prescription pills, the active ingredient that you're seeking is known. It has this many milligrams of.
And an opiate is like morphine?
Yes.
Yeah, okay.
In heroin, it might be 50% pure and 50% a cutting agent. It might be 60% pure and 40%. You never know. The addict on the street doesn't know that.
No quality control.
No, there's no quality control in the illicit drug business. So that's one of the things that make these so susceptible to overdose.
I see. So it's exciting that part of this bill, this heroin bill that is now law in the state of Kentucky, has this caveat in there for getting it and making accessible this, how do you say it?
Naloxone.
Naloxone, so that we can maybe combat some of the overdoses, but you still need to call 911. Before the break, we mentioned something called Vivitrol. This is something that is exciting. It's new on the scene, and it blocks the inhibitor. Help us understand that.
Vivitrol is a drug that was actually developed and marketed for alcoholism. Because what would happen is if you inject Vivitrol, it's a 30-day shot. The shot lasts for 30 days. And if you would drink alcohol, you wouldn't feel any effect of it. Then they started testing it on opioids and found out it attaches itself to the opioid receptors in the same way. So you go into the doctor's office, if you're an opioid addict,
yeah.
and you get this injection, and then if you were to use heroin, you wouldn't feel anything.
Because it's blocking the ability for that heroin to do what it does.
And it also reduces cravings.
Huh.
So the nice thing about an injectable is it can't be diverted. You don't have to worry about, oh, this is going to be taken out on the street and sold. The other nice thing of it is, with other medications, you have to kind of trust the patient's going to take it every day. Well, in this situation, you know whether or not you gave them an injection, and you know how long it's going to last.
Yeah.
And Judge Tapp over in Somerset, he has a drug court and is doing a pilot program with this drug over there. And actually in the heroin bill we've been discussing, There is some money carved out for our Department of Corrections to do a pilot study with Vivitrol. You know, people are at the most danger of relapse and overdose when they're being released from a period of confinement, or leaving a long-term residential care facility, or leaving a jail,
because suddenly they're on their own again.
Because suddenly they're on their own. You know, it's kind of easy to behave in prison, you know, when you don't have access to
or
these
in a
things.
drug treatment program.
Or in a
sure.
drug treatment. The real challenge is when you get out. This kind of serves as a transition period, a bridge, while you kind of get your life together, get a job, get a place to live, get new friends maybe.
That's interesting. So it's called Vivitrol, and it's been available for a while?
It's been around for a while, but it's really starting to take off in the opioid space.
Okay.
And as I say, it was developed for alcoholism.
So we'll watch with interest in Somerset, Kentucky, as Judge Tapp kind of tests this out. So before the break, we talked a little bit about this, the heroin bill, how it is now law, but in our parts, in this part of our territory, it's still methamphetamine is just a big factor.
I'd say that's the squeaking wheel for us in Warren County, in this general area. Again, we did have 3 overdose deaths last year in Warren County that are going to be related to heroin. I understand we may have even had one this week. The toxicology's out right now. So it's troubling. We're buying a little heroin along from traffickers. Our detectives are focusing on that quite a bit, because we don't want to get to the point that Lexington, Louisville, and Northern Kentucky have
kind of nip it before it gets
I'd like to
that
think we
place.
could. I'm not sure we will, but at this point, the methamphetamine is still the
drug of choice.
major drug of choice in our area.
You know,
Let me go back and explain something.
Sure.
The reason why Tommy and I phrased that heroin is involved. Rarely are these overdose deaths just one drug involved. We're still seeing heroin, but we're seeing it with prescription opiates as well. Or we're seeing it with benzodiazepines, heroin and benzodiazepines. We're seeing heroin, alcohol, and cannabis all combined. So we're always careful and choose our words not to say it was a heroin overdose, but to say it was a heroin-involved overdose.
I gotcha.
Because rarely is there just one drug involved in the drug overdoses. And actually, it probably makes more sense to say the person died of drug toxicity, the way the combination of these drugs work together, as opposed to overdosing on too much of one substance.
And many times with that, unless the case is actually sent to the medical examiner's office for a full autopsy and toxicology, it's really difficult for the medical examiner to say without.
It was this or that.
Correct.
Yeah. What about the addictive nature of heroin? You know, you do a little reading on it, or maybe you know someone who has used it, that it's just very addictive. It's just a really great high.
Well, it's definitely a euphoric feeling when that drug hits your brain at first. You know, the center of our brain is where our pleasure centers are. And what happens with continued use of a drug like heroin or prescription pills, that part of our brain begins to take over, and other parts of our brain, our front lobes, where the part that does logic and helps us think things through, doesn't function at the same level. And that pleasure center of your brain becomes the dominant force of your brain. And that leads to poor decisions. And it's not just heroin. A lot of drugs are like that. Methamphetamine's like that. Prescription pills, when crushed and snorted and taken inappropriately, it's the same thing. Heroin's just what's in front of us today. But a lot of these drugs they work on cocaine. They work on that pleasure center of the brain, and for certain people, that's going to take over.
Yeah, that's the dominant. We also talked about taking over, if you will, drug cartels. You know, to say that and to hear that we have drug cartels actively involved in what's happening in the state of Kentucky, is kind of one of those, really?
Well, and you know, you have to relate that the cartel leadership, for the most part, in Mexico, but they have their underlings that branch out into the U.S., particularly the Southwest, is where most of the wholesale transactions go on. And they're the ones that get the feel for the supply and demand, or as we discussed earlier, you know, we can produce heroin cheaper than you can go buy pills scenario, so we ramp that up. So they they have their networks too and their business model, and that's what these guys operated as, a business, but a rather violent business, and their retirement plan's not too good.
No, but it's a well-oiled machine.
It is.
As we speak. We're just about out of time. We're talking with Tommy Loving, who is with the Bowling Green Warren County Drug Task Force, and Van Ingram, who is the Executive Director of the Office of Drug Control Policy in the state of Kentucky. And so you two can walk away, do a little victory dance. You worked really hard, and as a result of your hard work in the 2015 session, the governor today signed into law a heroin bill. But as you both pointed out, tomorrow it'll be something more. You know, this is one step along the way. So now what?
Well, for me, there's a big implementation piece to this bill. There's a lot of education to do with our law enforcement folks because the law's changed. There's education to do with our treatment folks to let them know here we have some funds available. There's just a big implementation piece to this bill. It'll take me the rest of the year working on that.
So your job has just begun.
Just begun.
Yes. And locally?
Locally, we welcome what we understand the sentencing guidelines, again, the naloxone, and again, the treatment options. You know, the street addict, we'd rather see them treated than go to prison, and now there'll be more resources for that. So we may have a short-lived dance, but we'll get back to work.
We'll keep on dancing.
But we're happy it finally made it through the legislature, and we have I think, all in all, pretty good bill.
There you go, and continued success to both of you for what you do, and thanks.
Thank
Tommy
you.
Loving has joined us. He is the director of the Bowling Green Warren County Drug Task Force, and Van Ingram, who is the executive director of the Office of Drug Control Policy in the state of Kentucky. That's going to wrap it up for this week's edition of Outlook. I'm Barbara Deeb. We're glad you joined us.